Okay everyone, and we are back to prime time. Thank you guys so much again for tuning in. We are on episode 19 already. I can't believe it. This has been really fun for me to just go through all these hot topics, and today we're going to kind of finalize the third part of the series, The Terrific Trio, cupping, dry needling, and hands-on care. And today we're going to really dial into what hands-on care really means to me and what it should mean to you, or what it could mean to you in your rehabilitation, in the process of being rehabilitative, in the process of getting back to doing the things that you love doing. And what I've noticed in the physical therapy world is hands-on care is really at a significant decline. I tend to find, especially from the volumization and insurance-based care, that clinicians, and I was a part of them at one point, I was seeing between 2 to 5 people an hour. Now, I don't care who you are, you just won't have the time to really get into the tissue the way you need to. You're too busy maybe taking phone calls, writing notes, looking across the room to seeing how your clients are doing. So really, if you're in that setting, it's to me impossible that you could really provide amazing hands-on care. Now, I also don't want to confuse my terminology of hands-on care with massage. I do feel like manipulations and mobilizations are a component or along the continuum of hands-on care, but I'm not necessarily specifically talking about that today. And not to be confused with some of these fancy terms out there, like neuromuscular massage, or maybe you might have heard of like active release treatments. There's also a plethora of tools out there now too that can kind of mimic what should be great hands-on care with those different types of massage tools or whatever you may buy. But to me, amazing hands-on care, which is essentially therapeutic in the sense that you are decreasing pain, you are purposefully improving range of motion. Maybe you're setting the table up for strengthening to occur. You're setting yourself up for success in order to work out again. That, my friends, is so incredibly crucial along the continuum in the rehabilitative journey. And again, I just feel like it's something that's completely missed out on. I know for me, I've tried a lot of different techniques over the years to figure out what works out best. What I've realized is that first off, we need to help desensitize the tissue. A lot of times when people are in pain, let's just say for simplicity, I'm working on the shoulder, just the process of touching lightly and loosely around that tissue can set people through the roof. And so therefore I realized that the tissue is incredibly sensitive, and not only the tissue, but their neuromuscular system is incredibly sensitive. And a lot of times when you're in pain, you're kind of in this fight or flight stage, right? I'm sure you guys are familiar with that, where you're in that zone or the sympathetic system where you're trying to run away from the bear. That's what it kind of feels like, and that's what pain can do to our body. It can kind of put us in that alarmed state. After we start the process of desensitizing it, it's really important and prudent to me that you are actually able to influence the tissue at a deep level. Now, a lot of times this does come with some form of discomfort. It does come with kind of that good hurt, I like to call it. But in my experience, to truly make a change, I really do need to get into the tissue at a deep level. If you break down the integumentary system, there's really 5 layers of the skin, and at the basement level where it connects to either the deep and even the deeper layers of the tissue, that's where I'm trying to get with my hands. I've tend to notice that slow, purposeful, deep kind of strokes tend to really help the client decrease their guarding, because a lot of times, I'm sure you've experienced massage where it feels like they're just kind of poking at you. They might even be grabbing the tissue and just kind of pulling at it. It's uncomfortable. It's hard for you to tolerate. That will not be efficacious or advantageous for you, because I can almost guarantee you're going to be kind of guarding it. So along with everything else I said, the positioning right before we really dig our hands into there is so instrumental. And this is something I thought was just common ground when I would go try out a lot of even massage therapists, because I was kind of curious where my hands-on care stood amongst all the massage therapists in the area. And don't get me wrong, there are some that are better than others. It's just like anything else. There are some that have a better tendency to really find the areas. But what I felt was lacking in really the hands-on care world were people's ability to purposefully set you up in the best position for success, where you're incredibly comfortable, where the tissue is exposed, where you don't feel like you're having to hold up an extremity or hold up a part of your spine. You're able to just truly let go. Once you're able to truly let go and get into a comfortable position, it's also, in my experience, usually really beneficial to try to put the tissue on stretch right before you get in there. So not only that, but also from an environmental standpoint, in a traditional corporate PT world, it's usually a big, open, fast-paced, busy environment. It's really hard, I know for me, to really let go. Let's say it's even in a vulnerable area. Let's say it's on the inside of my groin. How is someone going to expose that area if it's a very busy environment? I'm not, truly comfortable with my practitioner working on me because they're not even really paying attention to me. They're just kind of poking at me. And that is really the antichrist of really good care, if you ask me. So what we've noticed here at Prime Movement is we get someone in a quiet room. I might even put the music on that's most relaxing to them, or heck, just maybe some music that they really enjoy. Put them in that favorable position, and then I might do some superficial gauging to kind of see how tight or how sensitive it is. I'll do some exploration to see where exactly their tightnesses lie, where their trigger points lie, and not only active but even latent. The difference there is if you have an active trigger point, you're feeling that pain. If it's latent, that means we could probably feel that knot move around. You can feel the tightness in it, but it may not recreate symptoms. So from there, after I do kind of the superficial digging around, I'll use a lot of different types of techniques on my hands to help get into the tissue which feels most comfortable. So I might use the palm of my hand. I might use knuckles at times if it feels like it's really deep tissue. If it's a more superficial area and I'm just trying to cover a lot, I'll use even the side of my forearm. If there's a really dense, thick muscle that I know I need to get in there, and after we've worked into it to some extent to desensitize it, I will use the elbow and kind of go in there and feel through my elbow. Now, you have to be paying attention to the client and how they're responding and how you feel throughout this process. If they're grimacing, you can tell that they're feeling the good hurt. You need to also see when you need to back off. Do you need to work with their breathing techniques, to be able to allow them to take the most pressure possible, which we know is therapeutic. The myofascial system is simply amazing to me. There's been so many books even written about how we can just hold stress there. We can hold, psychological stress there. We can hold almost any type of stress in our myofascial system. And it's amazing to me the post-treatment experience the users can have, where they can oftentimes take a nap afterwards, like they're just exhausted because we released more than just toxins, but releasing memories, releasing stress, areas of stress that you've been holding tight, right? If you're stressed, you can imagine you're grimacing, you're guarding. If you can let go of that, which is what we do oftentimes with the muscles, people are exhausted. It's not uncommon for people to cry when they sit up and they're not even sure why they're crying. Sometimes it's almost tears of joy. It's pretty amazing, and I really feel like that is starting the process of encompassing what amazing hands-on care can be. And also too, for you that out there that are trying massage or trying this and that, I think oftentimes too what we're missing out is the ability to complement the hands-on care with really specific exercises that meet their therapeutic needs. So let's say I'm working along the upper back and I've loosened up some of those really tight muscles right around the shoulder blade area. And maybe I'm trying to do that so that the shoulder has more range of motion overhead. And maybe that's our goal, to try to get overhead range of motion. Well, it's really prudent to give someone an exercise that complements that hands-on care so that they can do that night or immediately thereafter, and or both, so that we can keep the range of motion, which was the main intent of the hands-on care, so we can keep it. I'm sure a lot of you can go and think that you'd go out and see a massage therapist or whoever it may be once a week, once a month, but you're noticing that you just don't keep that quality, that range of motion or that relief. And that's because oftentimes we're not able to have a proficient set of exercises that can keep that, both range of motion and strength. And that's something that we really strive to follow through here at Prime Movement. Make sure that let's not only accomplish what we needed to from the hands-on care, but let's give you that exercise, let's give you that stretch to abide by what I kind of call or think about the neurological window. The brain is plastic. It changes, it habituates. So we want to tend towards that and give it the opportunity, while it's most malleable, to learn how to achieve that range of motion, to kind of recalibrate the stability and the mobility paradigm that your body needs in order to keep that range of motion. It's not really as simple as just releasing a muscle and you're good. Your brain literally has to kind of recalibrate and go, okay, that's interesting. I used to think that I had to stabilize that area, but there's been an input into my body that tells me to release that area, and now I need to go around and figure out who's going to be my stabilizer. Because, for example, I thought let's say, rhomboids in the middle of my shoulder blade area, I thought that was supposed to be the stabilizer when I reached overhead, but there's been an input. There's been a mechanical input into my body, and now I realize that area is loose. So that's oftentimes where I see people immediately after, they feel loose, they feel light, and you can see their eyes ticking, their brain ticking, like, I'm not sure exactly how to do that anymore. I kind of have to relearn how to do that. Especially after a hip surgery or working on the knees. You can kind of see people kind of wobbly-legged when they start walking again, and oftentimes we joke with them, it's like you're trying to relearn how to walk right there and then too. So it's really important, really prudent to make sure that you have that follow-up in your plan of care, and that's where I want people to understand that you shouldn't get caught up in only the hands-on stuff. Absolutely, it has a time and a place, and some may need more of that than others, as we often store years worth of compensatory deficits in our tissue. And even as you've listened to these last three, including this one, episodes where we've talked about how amazing the cupping can be, how amazing the dry needling can be, and how amazing really great expertise level hands-on care can be, understand that that's only just a small part, a small piece of the puzzle in terms of helping you get back to doing the things that you love. The exercise, the stretching, and what we like to do is eventually, have everyone hop onto a strength and conditioning workout program. This is all to cement in those long-term benefits that you're looking for, because we don't want to waste people's time, money, or energy. Time is so important to people now more than ever. We're busier more than ever. So if we spend, let's say, 3 months with over the course of 12 to 15 visits, it's really important to us that we lock in, so to speak, or cement in that pain-free shoulder or back or whatever it is, because not only have we done the desensitization, the re-education to your body and to your brain, but your body is learning how to continue to practice that, not just with the exercises, but most often missed, how you're doing it on an everyday basis. Those fundamental movements, how you're putting your clothes on, for God's sakes, how you're standing, you're walking, how you're grabbing that cup overhead. It's really important to nail that, as well as the exercises in terms of strengthening and bulletproofing your body there too. So that's kind of where I wanted to go with today. I appreciate you guys hopping in. Just kind of a take-home point. I want you guys to make sure you're not wasting money. I want to make sure that you guys are finding the best care possible. So I do think there's a component to finding ongoing care, right? And not necessarily just maintenance, but always trying to move forwards. You guys might have tendencies, a gravity to lock in certain muscles. I understand that. But find that someone who can also, with the credentials to do so, make sure that that's there, that they can give you the exercises, the stretching, the exercise, maybe you have to go see a personal trainer to complement it, what have you, but just make sure you've got that whole package because that's what you'll need in order to get that long-term carryover and that long-term success. Guys, thank you so much and have a great rest of your day. Thank you for tuning in.